Let's go to Geelong now and catch up with Liberal Senator Sarah Henderson. Thanks for joining us again, Sarah. I want to ask you first about some breaking news. We've got reporting from the Aged Care Royal Commission specifically on how the aged care sector has handled the coronavirus pandemic. And they've said that it's very clear the measures implemented by the Australian government on the advice of the medical panel were in some respects insufficient to ensure preparedness of the aged care sector. That's a pretty clear indictment of a lack of preparation from the federal government.
Well, Chris, good afternoon, and I wouldn't accept that, but certainly the recommendations have already been accepted by the government, and I think we will move very quickly to look at those recommendations. We certainly do appreciate that the Aged Care Royal Commission has made these recommendations, and of course it was our government which set this up. We recognise that there are some deep-seated issues within aged care, and I think it's fair to say, Chris, that we have been incredibly responsive on what has been a very significant challenge during this pandemic.
You can't say you don't accept that. That's a direct quote from the report. They're saying it's clear that measures implemented by the Australian government were in some respects insufficient to ensure preparedness of the aged care sector. Now, that's all hindsight now, but obviously more could have and should have been done.
Oh, look, absolutely, Chris, and we will look closely at these recommendations. Of course, I can't speak on behalf of the government. They have just landed and I haven't even had an opportunity to speak to the minister, so I can't provide you with any formal response other than we really do appreciate that these recommendations have been made, and I know the minister will be looking very, very closely at them and acting very quickly on them.
Well, I've been on this since at least February because it was very clear, especially from the outbreaks in northern Italy, that the aged were most vulnerable and that our best approach was to protect the elderly as much as possible so that we didn't have to do too much elsewhere. That's why one of the reasons it's so important to learn these lessons now, isn't it? Even if they're too late for the aged care sector in Melbourne, for instance, and some centres in New South Wales, the more we can learn about how we can protect people, as difficult as it is, in the aged care setting, then the less we have to have restrictions outside of that in the rest of the community.
Well, absolutely, Chris, and that's why we were so concerned about the community transmission, because we always knew that seniors and people living in aged care centres were the most vulnerable. And of course, we've seen that explosion of community transmission in Victoria, unlike any other state. We are seeing these numbers rapidly drive down, but of course that did mean that those living in aged care homes were the most vulnerable, and that's been quite tragic and also incredibly disappointing to see how this has run out of control in Victoria. But the bottom line is, Chris, this is a very, very serious issue. It is an issue that the government does take very seriously, and that is exactly why we set up the Royal Commission. And
indeed, it is very hard to be across that detail. That's only dropped in the last half an hour or so. In fact, I'm relying on an ABC report there, of all things. God bless them, our taxes at work. Just on that, the ABC voting yesterday, 80% of their staff to, rather than be all in this together and accept a pay freeze, to take a pay rise. What's your view of that? As a former ABC journalist, no less.
Well, the pay rises weren't so easy to come across when I worked for the ABC, but I think it's a very bad decision. I think it is very insensitive, and of course it goes against the pay freezes we are seeing right across the public service. And I do think that the ABC should rethink its position and not go ahead with this pay rise, Chris.
Look at that, you and me, both former ABC journalists condemning their pay rise. How about that? Some of them deserve it, but I'm not certain they all do. And we are all in this together. There's been a lot of pain in a lot of sectors, including across the commercial media. Now, let's go to the big announcement from your own government today. Scott Morrison at the National Press Club, $1.5 billion, trying to bolster our manufacturing sector. Now, we all understand the importance of this, but it's been exposed even more through the pandemic, hasn't it? How we didn't have enough manufacturing capacity here for things like face masks, for surgical equipment, for ventilators. So we need to be more self-reliant in this country, don't we?
Look, absolutely. And if there is one issue that so many local residents here in the Geelong region and across southwest Victoria have raised with me, is the need for our manufacturing industry to be more resilient and more self-reliant, and us as Australians, of course, to be more resilient. So the announcement by the Prime Minister and the Industry Minister today is a very significant one, Chris. $1.5 billion, of course, as we know, our budget is all about driving jobs, and we recognise that boosting manufacturing, as we have announced today, is absolutely fundamental to restarting our economy and getting those jobs moving.
Now, we've still got heavy lockdown measures in Victoria. You've got Western Australia, Tasmania and Queensland still pretty strident with their hard border closures. Things starting to relax a little bit in South Australia. You've been keeping an eye on this. I'm just wondering whether you've ever been involved in any vertical consumption.
You'll have to clarify what that means, actually, Chris. I'm not quite sure. Are you talking about eating while having a mask on?
Well, apparently in South Australia today, the Liberal Premier, Stephen Marshall, you'll know him well, he's relaxed the rules so that in their hotels now they're allowed to have vertical consumption of alcohol so long as they are outdoors. That's the level at which we've got government telling us what we can and can't do.
Well, all I know is that our hospitality industry is on its knees, and I know so many businesses are desperate to open up. We now have got very, very low figures in Victoria, and of course there are almost no cases in regional Victoria. There has been some opening up, but not nearly enough, Chris, and I would really like to see Victoria move to the New South Wales model, where it rapidly gets on top of an outbreak through contact tracing and through suppression rather than shut down the whole economy. And it still profoundly worries me that we have to get to 0 cases for 14 days on average before we even get to the last step. I've spoken out very strongly about the restrictions. They are too harsh. They are causing too much pain, too much mental anguish, even for children. I mean, years 7 to 10 in Victoria, they don't even know when they're going back to school. Unreal. So we really have to dramatically change this roadmap. I call on Premier Andrews to do that again, because the economic carnage this is causing in Victoria is just unbelievable, Chris.
Spot on. Thanks for joining us, Sarah. I appreciate it.
Yeah, great to talk to you, Chris.
Senator Sarah Henderson there. I shouldn't have sprung vertical consumption on her, but she is dead right about Victoria. You've got to stop Victoria being horizontal. We need to see Daniel Andrews allow Victoria to be vertical in all ways.